Medical Dilemma.
Welcome back to Medical Dilemma. We now continue our discussion in the third segment, and this time we'll take a look at the question of informed consent. Okay, Attorney Sarah, you have a question earlier about informed consent among the spouses of
I think it was
Yes.
Father Jerry's question. Correct me if I'm wrong.
Right, I brought it out just after we ended with the second segment. And probably it's also good to discuss it because it's for the information of everyone. Things that probably they have also to know so that controversies will not arise.
Okay,
So
what's
in case the question, Father, was
The question is this. Now, as far as Doc is concerned, whenever, for example, the husband decides that he should have surgery, do you ask the wife to give consent?
Well, for me, as a practice, I always ask the family. But for the consent, I only ask the husband. Because as far as we know, well, correct me if I'm wrong, attorney, no? But as far as I know, as far as we know, it's the patient who can decide for himself what he wants the procedure done.
yes, it's not a decision to be made by the spouses. It's not supposed to be a conjugal decision. Although here in the show, kaya nga Medical Dilemma, we have varying positions on that. Like Father Jerry, for example, from an ethical perspective, thinks that it should be a conjugal decision because according to the Bible, what God has put together, or what was the
Well,
ethical
man.
basis? What was the ethical basis, Father?
Don't let
ethically
Dr. Nazareth
speaking, ethically
interfere.
speaking, when you get married, you're supposed to be one body, which means that your wife's body or your husband's body belongs to you. That's why there is exclusivity over each other's body, and then whatever you do to the other body also affects you. Okay, and from there, whatever the man's decision is, there has to be the part of the wife to also say something and make decisions for that matter. Although in the end, the decision must be such that it is always for the well-being of the patient.
the patient.
And
Can
I
I ask
believe
something,
many
Father?
Filipinos adhere to that conjugal decision when it
Right.
comes to any surgery to be done to their bodies.
But can I ask, Father, is it true for all religions? I mean, do you really need the unified consent or of
Well,
both?
this is ethics. This is not only Catholic religion. It is ethics. It is brought about by philosophy, which is according to reason. Okay?
Okay.
Precisely because, well, you cannot just decide on your body without asking permission from the wife. And why did you even, in the first place, get married? If the other one does not have anything to do with your body. Precisely, there is such thing as exclusivity. You cannot just tinker with your body. You cannot just put anything on your face, etc., which probably may be unsightly to your husband because you did not ask permission. You put a tattoo or hair something there. The husband did not know it, but of course he's going to ask, darling, why did you put some tattoo there or something like? You didn't even ask for my to call this opinion, something like that. He has also a right to know. He has a right also to make decisions because the body of the wife is also part of the body of the husband. Now that you are husband and wife, if you are single or well, you don't have anyone to ask for as long as you are an adult, 18 years and above. Go ahead with what you want to do.
Father, very delikado ito kay Sarah. Single. Might be discouraged.
That's why I was telling her, Sarah, you have to ask your would-be husband if he has some prostatitis or prostatic disease, something.
That can be a ground for annulment.
So if we
Anyway,
practice
maybe
that
yes.
perspective, if we practice that perspective, could we get tangled with the law?
The conjugal
perspective?
perspective.
The-
I mean,
yes,
that
like-
everything has to be a
With
conjugal
consent, of
decision
course.
when it
Yes.
comes to informed
Could we get
consent.
tangled with the law?
Oh, well, okay. Let me give you a concrete example. As Father said, Doctora, I believe she raised it earlier that it can be grounds for annulment. In fact, we have a Supreme Court decision wherein the erectile dysfunction of the husband was the ground for the annulment, the declaration of nullity of the marriage. There was no marriage because there was no consummation.
Consummation.
Because the
That is,
husband
but that's
cannot
from the
deliver.
start. That was from the start.
Yes,
This
from the
one is
onset. But this
after
one is after
years of
surgery, for
marriage and
example.
children.
Yeah. So
Oo.
well, it can also it can also affect. It can also be
Another
something to be
ground.
decided upon by the court. Yes, another ground. If not for annulment, maybe
Because
legal
my-
separation.
Well-
We need jurisprudence there. We need jurisprudence there. But as far as ethics is concerned, well, from the very beginning, it was already valid. You cannot invalidate something which is from the very beginning valid,
Yeah.
which was brought
So
about
the-
by
the
disease.
marriage,
Well, we cannot
yes.
do anything about it. It was brought about by disease.
After
How can it be
the
invalidated?
marriage. Yes, after the marriage.
After
it
the marriage,
existed after
it was
the
already
marriage.
valid.
Oh.
But even the church, for example, that's also a ground for declaration of nullity of marriage.
But I
once it has
agree.
been proven.
But I agree. If you're married late and really there is prostate CA there, you can that can be a ground maybe.
For annulment of
Yes.
marriage.
But of course, we have to take into consideration the toll it takes on the couple, on the relationship, yes, after such a consequence. Now, it may cause, stress, knowing that one partner cannot perform and the other partner will no longer be satisfied. So,
well, it's something which is also a dilemma. After, for example, 30 years of marriage, that you have lived the quality of life of marriage. Now here it is, she had a disease like this. Cannot they also understand why at this point in time, we must be also willing to make sacrifices? Are you going to destroy such beautiful relationship before just because you cannot anymore have erection?
I think
That's something.
I think, Father, the question there is if you have a new wife or a younger wife with,
A
a
new
more
model traded in for the old one.
trade-in model. No, because especially for foreigners
Yes.
Right.
who will have another a
Family,
lot
a
younger
family, maybe,
Filipino
yeah.
wife,
Right.
who is at the prime of her
And who
sexual
wants
awakening.
children likewise. And who wants,
Sexual
who wants
awakening.
children, a family, right? They
Yes.
want a
Well,
family.
in the first place, probably disclosure is very important.
Yes.
Disclosure.
Disclosure.
That I am like this, like that. Are you still going to marry me? Something like. Well,
Well, I
Because,
guess I can ask kay attorney yung what if this couple, older couple and a younger wife, and then the husband decided to undergo the surgery without telling the wife. Okay, for example, the wife is for one reason or another was outside, abroad or anything, and then comes home realizing that the husband has had a prostatectomy and then can no longer
Impotent.
yes.
It's impotent.
Is there a grounds for like
More of a legal separation.
Legal
So
separation.
The wife can have a legal separation from the husband. So it affects property relations. That's why people seek annulment in courts or custody of children, if any. But if they're willing to work together in the relationship and stay together, then there's no reason for them to go to court.
Now, something connected to the genitourinary system, but not really the prostate, is the topic of vasectomy. Okay? I heard that vasectomy can increase the risk of contracting prostate cancer. Is that true?
No, there's no truth to that. Otherwise, there have been a lot of people undergoing vasectomy, but it has not been proven that these people develop prostate cancer more than the ordinary people, not having undergoing the vasectomy. So there's no truth to that
I see.
claim.
Well,
Okay.
vasectomy in itself already has a lot of ethical issues to contend with.
Let's ask Father.
well, one of the things that probably we have to always remember is we have a principle in ethics, the principle of totality. As we have already mentioned before in many segments, that, you cannot do anything with a healthy organ. If it is healthy, then let it stay there. Because the only way by which you can sacrifice an organ is when it is diseased, and it is for the well-being of the totality of your health. If it does not contribute to the totality of your health, then by all means, respect the presence of a healthy organ. It is part of your reverence to a sacred body. If it is healthy, why do something if it is healthy?
Well,
Something like that.
some argue that undergoing vasectomy can help preserve a certain quality of life that invokes dignity for a family.
I don't know. I don't know if that is true. Or that if you remain unvasectomized, you will not be able to have that dignity.
Father, if I may, I would like to play devil's advocate. But I have to make this disclosure that I do not do vasectomies simply because I choose not to. Okay? Because I also believe in the Catholic teachings that we don't. But I would like to be a devil's advocate because if we were to look at the medical side of things, one of the frustrations of doctors is treating patients, wanting to give them the best possible medical treatment that they can have, but these patients cannot afford it simply because they have like 10, 20 children waiting. Okay, so the number of the poverty line because of having too many children becomes a dilemma now for the doctors. They feel frustrated knowing that they want to treat these patients, but they cannot simply because they would much rather buy food for their children than have themselves checked up or operated on. Or these are the dilemmas that the medical field is trying to. That's why most of them are really into this artificial contraception and all these
Birth control.
that really go against the teachings of the church.
But you see, we have to look at it in a rather panoramic view. There is no evidence or there is no statistical truth that just because a country has more population, it is poor. No. There is
China is the best example of
China
that.
is the best example. It's the richest now. It's trying to overcome America already.
But
And
it
we were
still have-
able to
but it
produce
has
a
a
lot of
one-child
products
policy
around the
still.
world because of the many of the such large population that they have. If they don't have such a population, I don't think they will be able to produce such products around the world. That even our toothpick is made in China.
But,
Just
but
toothpick.
I don't see any relevance between population and growth, industrial growth. Remember they had this one-child policy for so long a time, and even up to now, it's still one child.
It's a one-child policy, but still there are still many children. Okay. As a matter of fact, with
So
the
the
one-child
biggest
policy,
population.
the ethical dilemma there is like this now, and it's going to hit China 25, 30 years from now. Because they have only one-child policy. For example, most of the couples would choose boys.
Boys, yes.
Yes, yes.
So how many now are in population
Aborted or
pyramid?
discarded.
There is already a disproportion between girls and boys. They have now 25 million more boys than girls, because of the choice. So what kind of social problems are they going to face 25, 30 years from now?
Homosexuality.
Homosexuality,
I think they
rape,
have-
etc. Because just imagine 25 million more boys.
Yeah.
Where are you going to put? Where are you going to put these
If
boys?
I'm not mistaken, I think China has already relaxed the one-child policy to
Precisely
a
because of
two-child
that.
policy.
Precisely, they want to have more because all the world are dealing business with China. See? So
I see.
here you will be able to see, it does not mean that because the population is big, it is poor. No, that's not right.
Yes, Father, but of course, as I was telling you, doctors do not see this. They only see what come into their clinic.
The immediate scenario.
Yes, the immediate. So that's that's just
Personal.
put
It's personal to that
it's
family,
more
for
personal,
example.
and
That's
then
why, okay.
and then that's where the frustration of a physician lies, that they cannot do much for these patients simply because they have other priorities rather than health.
Right. But you see, that's why I said, in a panoramic point of view, we have to see
Yes.
it. The better things that will come if you see it on a generic sense or panoramic sense. And if you also do it also even personally, when you might be very discriminative. Why? You don't tell this to a rich man who wants to have a lot of children. You don't. Only to a poor man. Why only to a poor man? So here comes now the dilemma. It's a choice.
I see.
Although if patients don't want to avail of vasectomy, I believe there are natural ways of.
There are.
Yes.
In fact, they are also effective. There are so many ways to do it. Okay.
Doc, I'd like to ask a question in terms of preventing prostate cancer. Is there such a thing as too much sex or too little sex when it comes to preventing cancer in men?
Are you by any chance asking me or telling me?
I'm asking if there is
Are you also going
there's a
to ask me?
correlation. The vow of celibacy, chastity prevents you from.
I always tell this to my patients in reference to priests, actually, Father and all. I always tell them that I always tell them that if that were the case, then I would have a lot of priests as patients who have prostate cancer. But I don't. They're basically just the same.
So it's not a matter of having sexual activity.
That's a good information,
or
Doc.
but
presumption.
that comment is a good excuse for men to have more. Diba?
Okay, well, sorry to say, but we've reached the end of our show. Maybe a few words before we say our goodbyes to the audience. Attorney Sarah?
All right. For all those watching, please keep watching Medical Dilemma. We'll be entering our second season soon. And we'd like to thank, of course, our guest today and the Basilica of Our Lady of Manaoag for sponsoring this show. Thank you.
Okay, Dr. Nazareth?
Yeah, thank you very much for having me. I hope we were able to entertain and as well as educate our viewers. Please see your urologists every so often.
Okay, Father Jerry?
First, I would like to thank Doc for the beautiful and marvelous information that you have given to us. Continue watching us. You are going to learn a lot.
Okay, Dr. Ates?
Well, this is, I think, in one area, cancer, where it's equal between men and women. So try your best to take care of your good health. Maintain it.
Okay, thank you so much, everybody. It seems that prostate cancer isn't really a man's downfall. A man's real essence lies not in the health of a one walnut-sized gland, but in the way he lives his life with dignity and integrity. Thank you for tuning in to Medical Dilemma. Next week, we will tackle the topic of vasculitis. So don't forget to catch us again here on GNN, Sunday, 6 p.m. Okay? You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you. Thank you.
Medical Dilemma